Hi there. My name is Randy. I'm a nurse here at the office, and I'm going to be performing a chest and lung assessment today. Can you tell me your full name and date of birth?
Taylor C., August 3rd, 1986.
Awesome. Okay, Taylor, before we get started, I'm just going to step aside and wash my hands.
Okay, great.
All right. All right. So to begin, I'm just going to kind of go over a brief history and ask you a couple questions, okay?
Okay.
Do you have any history of asthma, COPD,
No.
any long-term coughing,
No.
tuberculosis?
No.
No? Do you smoke?
No.
No smoking. Does anybody in your family smoke?
No.
No. Are you surrounded anybody at work that smokes?
No smoking.
No smoking at all. Okay, awesome. Any family history of like lung cancer? Anything
No.
going on
No.
lung-wise?
No.
Okay, cool. All right, so a few of the things I'm going to be doing today. You're going to be feeling your back, feeling your chest, listening to your lungs. A couple different tests that are just going to let me know that your lungs are healthy.
Okay.
Okay? So I'm going to have you take your shirt off if that's okay. Is that, yeah, you can go ahead.
Okay.
All right. All right, thank you. We're going to start with the anterior side. And you just go ahead, you look at me, look at the camera, it doesn't matter, okay? Wherever you're comfortable. So we're going to start, the first thing we're going to do is inspection. I'm going to point out a couple of landmarks. I want you to tell me when I'm feeling around if you have any tenderness, any pain, okay? All right, so the first spot I'm just going to feel, sorry about this, I'm just going to feel your trachea, it's here, okay? And then this little spot here, we call this let's see, suprasternal notch. Below that is the angle of Louis. And then here, because he's in such good shape, we can see it pretty easy, it's costal angle, okay? So any pain, now I'm just going to kind of feel around here, any pain, any tenderness?
Nope.
All right, very good. Okay, so the first thing I'm going to do is checking for, it's called tactile fremitus. I'm going to have you say that just 99. When I touch your skin, I want you just to say the words 99, okay? I'm just making sure that the vibration I feel in my hand is equal, okay?
99. 99. 99. 99.
All right.
99. 99.
All right, very good. All right, and everything felt equal from side to side. And again, in this inspection or this assessment, I'm going to go from side to side, never down each side. I'm always going to go from side to side. Okay, so everything felt normal there. The next thing we're going to do is percussion. Okay, so before I start, I'm going to place my finger in each one of the intercostal spaces between your ribs, and I'm going to thump. If it hurts, you can tell me to stop, but we'll hear a sound. I want it to sound like resonance, okay? It's what we're going to hear over your lungs.
Okay.
All right? So, and you might not hear it on the camera, but we can. When I practice with the other hand, so it's not as good. Sorry, but. All right, everything sounded good there, so nothing abnormal. The next thing we're going to do is auscultation. I'm just going to actually take a listen to your lung sounds to begin with, okay?
Okay.
And you just breathe normal for me, okay? All right, nice deep breath. All right. All right, just two more here for me. All right, very good. All right, the next three tests, and we're going to go through it pretty quickly, is going to be to check for consolidation in your lungs. It may be a sign that there's fluid or some sort of infection in your lungs. We don't expect to find anything abnormal, but just three quick tests, and it's going to involve you just saying some terms for me, and I'll let you know. Okay. First one is bronchophony. Bronchophony, these words are hard to say here. I want you just to say 99 again, okay?
99. 99.
All right, very good.
99. 99. 99. 99.
Okay, very good. And that was equal from side to side. If it was louder in one spot, it might be a sign that there was consolidation, okay? The next test, and it's just like that, egophony. I want you to say, kind of hold it for just a second, but I want you to say the letter E, okay? When the stethoscope touches you, say the letter E. We're making sure that it doesn't sound like the letter A. If the E turns into like the sound of an A, it might be a sign that there's some fluid in your lungs. Okay?
E. 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 E.
Okay, very good. All right, everything was normal there. The last test is called, and this one's a hard one to say, it's whispered pectoralically. Sorry, probably didn't say that right. I want you to whisper, you can either whisper 99 or 1, 2, 3. It doesn't have to be loud enough for the camera. If I hear it louder in one spot than another, it might be a sign again that there's consolidation, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
All right, very good. And everything, I could barely hear that, so that's a good sign. All right, that kind of covers it for the anterior side. We're going to go posterior now. And if you actually just turn maybe just a little bit right there's perfect. That way the camera can see part of your back and I can hopefully still be in the shot. All right, so again, with the assessment here, we're going to start just with inspection. So I'm just making sure that there's nothing wrong with the skin. There's no just abnormalities. Everything's symmetrical. Everything does look symmetrical. So Taylor, I'm just going to start by feeling around I'm going to go down your vertebral column here, okay? I want you to tell me if there's any pain or tenderness. Okay, and right here, this notch that we feel here would be the vertebrae C7. Right below that's T1. Taylor, I'm just kind of feeling around here. I want you to tell me if there's any tenderness, okay? All right. Any tenderness there?
No.
All right. Any tenderness when I do this?
Nope.
Okay. If there were some tenderness in that area, it might be a sign that there's something going on with your kidneys. Okay, so nothing that you feel, no tenderness. Okay, no tenderness through any of there? No? Okay, very good. All right, so we're going to kind of go through and do the same thing that we did on the front side. I'm going to ask you, we're going to start with the tactile fremitus, and that's when I put my hand in between the intercostal space. And I just want you to say the term 99, okay?
99. 99. 99. 99. 99. 99.
All right, you're doing a really good job. The next one we're going to do is percussion. All right, so the same thing I'm going to tap. Well, you don't actually have to say anything. I'm going to be tapping my finger, okay? I'm actually going to switch hands. All right, sounding good. We're going to go through the breath sounds again. You can either say 1, 2, 3, or 99. The first one we're going to do is the bronchophony. Okay, so when the stethoscope, when the bell of the stethoscope touches your skin, I want you to say 99, okay?
99. 99. 99. 99. 99. 99.
All right, very good. Next, egophony, we're going to do the same thing. I want you to say the letter E for me, though, okay?
E. 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 E.
All right, very good. Let's see, and the last one, the whispered, hey, I'm going to say whispered P, okay? So, because I can't say that last word. We're going to get through it. I want you to whisper either 1, 2, 3, or 99, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, and everything sounded, I barely heard any whisper at all. It wasn't louder in one spot or the other. The next thing which I forgot to do is to check for symmetry. So I'm going to put my hands on basically on your costovertebral angle here, which we can see right here. And I want you to take a nice deep breath for me. All right, exhale. Now, I don't know if you can see that on the camera, but my hands move symmetrically to sign that there's no abnormalities. Okay? And the last thing I want to do is just take a nice listen to your lung sounds here. Okay? So you're just going to take nice deep breaths when I put the stethoscope. Okay? Exhale for me. Nice deep breath. Okay. Doing a good job. Okay. All right, very good. No adventitious breath sounds, no crackles, no rails, no friction rubs, everything sounded normal. And the pattern that we used, we started with the tracheal breath sounds, and this was on the anterior side as well as posterior. And then we moved to the bronchial, the vesicular, which is kind of in the middle of the lung bases. And then we have the vesicular, that's kind of the bases of the lungs through here. And that's the kind of the pattern that we're going to use to listen and kind of do our entire assessment each time. We're starting at the top of the lungs, or the apex, and we're moving down to the bases of the lungs. So Taylor, that's the end of the assessment. If you want to turn around for me. Do you have any questions for me? No questions? All right. Thank you very much.
Thank you.
All right.